on the web and in your hands. This is MDI TV.
For a woman considering some cosmetic alterations, it sounds too good to be true. Taking fat from an area where it's not wanted and putting it into her breasts. It's called fat grafting, and it's a controversial alternative to breast implants that's getting renewed attention after a leading plastic surgery society eased its cautions about the practice. Until a few months ago, the American Society of Plastic Surgery warned against attempting substantial breast augmentation using a patient's own fat, usually collected during liposuction. An updated report concluded some of the concerns about interfering with mammograms and other potential risks might not be as great as had been thought. Yet even as that report emphasized that fat grafting should be done only by highly experienced surgeons, the Society's relaxed stance seems to have encouraged a surge in doctors with relatively little experience pumping up their marketing efforts. One plastic surgeon who does use fat grafting as part of some breast reconstructions says he's not planning to offer it as an alternative to breast implants. Dr. Bruce Carter points out that no scientifically controlled studies have been done of women who've had fat transferred in order to enlarge their breasts. Among the lingering concerns, the volume of transferred fat can shrink over time.
I think it still needs to be done under controlled situations where maybe one or two practitioners are doing this with patients that we can study before and after, rather than having the general population of physicians doing this without rigorous control.
The American Society of Plastic Surgeons Fat Graft Task Force noted that strokes and at least one death have been linked to complications during the procedures, and that even when patients recover just fine, the cosmetic results may depend on the surgeon's individual technique and experience. So how do you select a qualified surgeon? That can be difficult. For example, many of the doctors listed on one website promoting the benefits of fat grafting are gynecologists, family physicians, and others who may have only minimal training in breast surgery, not the extensive specialized instruction of a board-certified plastic surgeon.
To perform surgery on the breast when you have no surgical training, or you have surgical training in another part of the body, but not on the breast, is I think, somewhat astounding.
The financial rewards of doing cosmetic surgery can be substantial, yet there's relatively little official oversight of doctors who do procedures in their own private clinics rather than in an accredited hospital.
If you're a psychiatrist and you want to inject fat in the breast, there are no laws that prevent you from doing that. The only thing that could prevent you is if you mess up and someone sues you. But that psychiatrist the hospital would never let them operate because they know they're not qualified. But they could still do it in their office legally. And that's almost all the states of the United States.
If you want to find out if a doctor is qualified, here are some tips for cutting through the hype. Go to vitals.com and look up the doctor's name. Check to see if he or she is board certified by the American Board of Plastic Surgery, because a doctor's license really only tells you that he or she graduated from medical school. A license is no guarantee that a surgeon has been specifically trained to do breast augmentation surgery. Membership in a professional society of plastic surgeons may also indicate that the physician meets more than the minimum legal standards for medical practice. Bottom line, while the latest report from the American Society of Plastic Surgeons concluded that transferring fat to enlarge a woman's breasts may not be quite as risky as once thought, falling for marketing hype could still lead to disappointment or worse.